I'm very now pleased to present Barbara Kelley, who is going to sum up for us. She is the Executive Director of the Hearing Loss Association of America. Barbara.
Thank you, Ruth, and thank you, everyone. I think to get the global perspective on what's happening is really eye-opening. And Sue has asked me to cover just very briefly what's happening in the United States as far as funding with cochlear implants. Could I have the next slide, please? We have a number of funding sources in the United States. We have Medicare, which is for people over 65. This is a government funded program from tax dollars. Medicaid covers cochlear implants in all 50 states for children. And sometimes when the children turns 21, depending on the state and the income, Medicaid might also pay for that cochlear implant. We have private health insurance that covers cochlear implants. TRICARE, which is for our military, covers cochlear implants, as well as the U.S. Department of Veterans Affairs and other federal plans. More than 90% of private employer health insurance plans cover benefits for the cost of cochlear implant surgery and related services. And these are plans that, as an employee, we would pay partially into, and the employer would pay the other part. But although it seems like compared to the other countries that we have a lot of coverage for cochlear implants, there's still the challenge of raising awareness and increasing access and improving cochlear implant services. There's confusion sometimes with insurers who think that a cochlear implant is a hearing aid. And as soon as they hear that, they want to deny coverage. But we have anecdotal evidence that says when people appeal, they can get the cochlear implants covered. And also the cochlear implant companies all have reimbursement departments who are willing to help the patient and their families get insurance coverage with their providers. So there's still that challenge in the United States. We hear people tell stories of working with their audiologist or hearing aid specialist who won't refer for cochlear implants. Either they don't really know about them, some general physicians don't know about them, or there might be they want to hang on to that patient as a hearing aid wearer. So we hear stories about that as well. Could I have the next slide, please, Kes? This quote I love. This is from Juan Zamora from AIC in Spain. And this is the organization in Spain for cochlear implants. And I think I could not sum it up any better than he said. He said, I think KICA has a very promising future and a great job ahead of it. It is a meeting point for everyone to take advantage of their experiences carried out in other countries and generate a great collective conscience. And that's what I feel we have here today. I mean, we all can agree that the main point is that cochlear implants are cost effective. They're effective for quality of life for people with hearing loss. So we need to get past that debate. And I think Daria made the point, and Sue made the point, that it's not just implanting the device, it's aftercare. I mean, when we go and have a hip replacement or a shoulder surgery, in this country at least, not only do you have care, but you have a whole plan for aftercare. And, you know, hearing loss, hearing health is a journey, and it doesn't stop with that implantable devices. So I think our message today to take home is we have this fantastic collective consciousness of information, and this group is very well informed, very motivated, but we need to share this information, get more people involved with coming to KICA, and find ways to advocate as individuals, as organizations. And, you know, advocacy happens a little bit at a time, but we know that it's effective. So thank you to all the presenters today. This has been eye-opening and really informative.